I was at 6:28 last.
Today's chapters is going to be easy.
Can you write that down instead?
We're only doing 2 simple chapters.
2 simple? Yeah.
All right. This is your theme. All right, fix it how you see fit.
You need a tripod, Dr. Sanders.
Is this one of those tracker ones?
What was the one?
It is, but I don't know how to use the tracker very well. All right. I'm ready.
You didn't show your
The live?
I sent you my boss.
All right, guys, let's finish because we only got less than an hour. Gynecological issues. One of the main things that you need to make sure you familiarize yourself when it comes to women's health is knowing some of the gynecological issues, especially when it, such as menstrual disorders. You need to know the common menstrual disorders that females in general, or those with a female reproductive system, experience, okay? One of them being amenorrhea. Real quick, Jenny, what is amenorrhea?
They don't have menstruation.
They don't have any menstrual cycles.
Yeah.
Treasure, how many types of amenorrhea are there?
I didn't learn that yet.
See, when I do pre-lecture quiz? You see? That's the reason for pre-lecture quizzes.
You must have seen that. 2.
Huh? Okay. Treasure said there's 2. Science says there's 3. And Jenny said there's 4. Kirsten, oh, damn. Okay, tell me. What are the 2 types, Treasure?
Come on now.
You know that was coming, bro. You already know that was going to come up. Hurry up!
And secondary.
Huh?
First and second.
First and primary and second. Give me all 3. You said there's 3.
So the one for menopause.
Well, that's what I thought too. It's for like it can happen in all those different types of stages in a woman, but that doesn't mean there's.
What does the book say? Validate what the book says. Anna?
Isn't it primary where it's like your menses, it comes regular every month, and then secondary is like basically you have a health condition that is making you have amenorrhea.
So you say primary is because your
3.
menses stop coming every month, and then secondary is because of a health issue.
But it says there's.
Dr. Dre?
So it says there in literally like 2 slides. It says 2 types of primary amenorrhea: absence of menses by age 14, with absence of developmental blah blah blah, and then absence of by age 16 with normal developmental secondary sexual characteristics, and then the secondary, which will be 3,
So there's 2 main types of amenorrhea.
which is primary, secondary.
Primary, secondary. You must know that in case it could come up on somebody's exam. I don't know.
Is it yours?
Maybe. Who knows? Okay? But within the 2 types, and make sure we know the difference of the different types. Okay, the differences between the 2 types. Primary amenorrhea, again, Jenny just told us that primary amenorrhea is basically you ain't got no menstrual cycle. Okay? With the primary is basically you don't have a menstrual cycle because your body isn't there yet, isn't developed for that process to take place. That's one type of primary amenorrhea. And then the second type of primary amenorrhea is because of by the time you get to age about 16 with normal development of secondary sexual characteristics. Okay? Now, secondary amenorrhea is because of, like Nurse Anna Banana just told, oh, I shouldn't say Anna Banana, huh? Nurse Anna said it's because of health issues, okay? You have, and notice what it says. With secondary amenorrhea is the absence of regular menses for 3 cycles or irregular menses that have lasted for about 6 months, okay? And that can happen for a plethora of reasons before we get into that. And we're gonna get into all of that. Then you have another issue, menstrual issue, which is dysmenorrhea. What is dysmenorrhea?
Painful.
Painful. But isn't it normal for us to have for women to have painful menstrual cycle?
No, it could be normal.
Oh, Anna says it could be. Kirsten says it shouldn't be. Sabrina shaking her head, it shouldn't be. Okay, argue your point.
I mean, normally us that get periods, we have cramps.
We have cramps.
Uh-huh.
Mm-hmm. All right. And Dr. Dre, from a male standpoint, is saying, y'all. Okay? Now, hold on, before I get you, Gisele. Kirsten, why you say it is not acceptable for us to have painful or for us to experience dysmenorrhea?
Because, I mean, yes, like, we do get cramps and stuff like that, but it shouldn't be painful, like, to the point of, like, it is, like, I don't know how to explain it, but it shouldn't be, like,
I feel like it depends on the definition of
yeah,
pain.
like,
But it
Like what's expected versus not expected.
that's the problem, if we deal with it too much, and then we're like,
Okay.
just deal with it,
Gisele?
we have to
I
deal
think
with
in
it.
prep view, like how she was saying, in prep view it says that cramps and pain are like two different things. Like
Yeah.
I remember the options was like abdominal pain and then cramps. So like they
It's like, yeah, it's like a
differentiate it.
subcategory type of thing, I don't know how to
Mhm.
explain
Like
it.
if it interferes with daily life and routine, then it's more like dysmenorrhea rather than like normal menstrual cycle pain.
Okay, you want to say that a little louder, please?
I feel like dysmenorrhea is pain that with your period that interferes with your daily life and it's impeding you to complete daily routines and tasks.
So dysmenorrhea is basically, according to Nurse Grace, is basically pain that basically impedes you from doing your normal daily activities. Okay, okay. Someone else has their hand raised. Was it Sabrina? Sabrina, you said we should not be having pain?
No, because I would think, along with all of what we've been taught before, that pain is a sign that something isn't exactly right. And I do know, like, touching off of PMDD up there, that when we have histamines in our body, that reaction with our menses can cause pain. So there's something possibly not going on right in our body. We should be able to not have pain.
Okay, we should not be able to have pains. All right, Melanie, and then Grace.
Well, like in the book, it says that there's also two different types as well that it can fall under. And like secondary dysmenorrhea can also be from like having like, you know, other diseases like endometriosis and stuff that can be causing other types of pain, not just from like cramps or, you know, normal things you would experience in a regular menses.
You see, you say normal. I have a problem with normal. Okay? Because what is normal for me may not be normal for you.
Okay, so without an underlying cause of it.
Okay, let's be more as specific as possible because one of you said pain is subjective. Somebody said it, at least I imagine somebody saying it, right? Okay, so if pain is subjective, I need to know. Like there are people I could walk around, like I could be on my menstrual cycle right now, and I got like, you know, like it's like really hurting me. Okay, but I'm walking around like it's all good. You know what I'm saying? And you wouldn't, as a nurse, you wouldn't even think to assess because I'm not showing any physical signs that I'm in pain, so you're just gonna brush it off, correct? So you need to define, be specific as to what is abnormal, what is normal. Does that make sense? Grace.
It was kind of what Mel was saying, but also like with pain, like I forget who said it. Someone said that you're not supposed to have pain, but like when you're having a baby and you're contracting, like that's painful. The body's supposed to be contracting, and like yes, that causes pain.
Mm-hmm.
But then,
So now it goes back to, was it Melanie that said the two types with regards to a dysmenorrhea? You have to know that there's two types of dysmenorrhea or painful menses. You must know this. All of you, men included, okay? So when a woman comes to you talking about, I'm in pain, you gotta ask certain questions, first of all, or collect certain data. In other words, hint, hint, you gotta do what?
assess.
Oh. The mental's coming right back again. Primary dysmenorrhea is caused by this hormone called what?
Prostaglandins.
Prostaglandins. Okay? Primary dysmenorrhea is a dysmenorrhea or spasmodic pain that is caused by prostaglandins, okay? And secondary dysmenorrhea is basically because of what?
Congestion.
Be specific. It could be specific. What health condition?
Endometriosis.
So it's pelvic or uterine issues, okay? Like you said, like endometriosis, etc. Okay? So make sure you know that basically primary is from hormonal changes, and that specific hormonal changes is prostaglandins. Secondary amenorrhea is because now you have a pathologic underlying health issue that's taking place specifically within the uterine or the pelvic, okay? Such as endometriosis. Now, this is why when a woman comes to you and say that they are in pain or they're experiencing some level of dysmenorrhea, what are some questions, Nurse Atrice, are you going to be asking?
You hungry?
Where do they feel the pain?
Okay, location of the pain. All right, Anna, and then Kirsten.
When was your last period?
When was your last menstrual cycle, Kirsten?
What are normal symptoms for you? Like, what's your usual symptoms?
Period! Okay, look at her trying to, because she knows what to say. I was going to get her with regards to normal. Okay, look at her trying to save herself. I see what you did there, girl. I see what you did there, girl. I see what you did there. Okay, you saved yourself a little bit. Okay, what is normal for you? And how do you define normal for you? Okay, and what changes have you noticed lately? What have you? Okay, never mind. Okay, boom. Who else had their hand raised? What other data will you collect?
Sexually active.
Oh. Let's talk about sex, baby. Let's talk about. Okay, Andy, look at this. Okay, what sex got to do with this?
Everything. If they're sexually active, there's so many changes that can happen in the body.
Any contraceptives?
Oh.
Hormones, yeah.
Oh. Okay. All right. Okay. Thank you, Nurse Jenny. Nurse Adriana.
Their objective history, like how many children they had.
Wait. Wait. What? Well, hold on. What children got to do with this? This dysmenorrhea.
That's technically trauma to the body.
Okay, so you're gonna ask the number of children. Okay, what else? What questions are you gonna ask related to dysmenorrhea?
Nutritional status.
That's not the stove. Bruh, what you mean nutritional status? What food got to do with anything?
Everything.
If you're eating junk, it's gonna be junk.
Wait, Alex! Alex! Hold on, don't make me happy. Wait. Can you say that one more time, please? If you're eating junk, what's gonna be junk? You gonna be. Okay. Can we read, does the book go into about nutritional status and menstrual cycle?
No, it has I think there's a table that just says eat a balanced diet rich in vitamins and minerals. That's for managing it though.
Oh no, say it again.
It says, so was it page 92? 4.2 tips for well, that's healthy lifestyle. Here on your chart, it's 4.3. It's
91, it says that physical examination should begin with the overall assessment of the patient's physical status.
Listen, I don't have enough room. I'm gonna need a different room.
It's 95.
Okay.
Yeah. It's page 95.
Guys, when it comes to the menstrual cycle, what Alex is saying is also very true. Not that to discredit what the assessment data that you said you would collect, but nutrition does play a major role in what experiences that a woman will experience as it relates to their menstrual cycle.
And exercise.
Oh, so if you are eating junk food, nothing but what nerds, Takis,
Cheetos.
Cheetos.
Don't look here. I got nothing.
Grady's been eating the same meal since he started nursery.
Okay. Oh yeah. Okay. You not eating broccoli and what grilled chicken? What is it? Peanut butter rice, peanut butter rice cakes. You know, with strawberries or blueberries, which was very good. Okay. Okay. We might have a problem. Okay. So one of the data you may want to collect as it relates to a woman experiencing dysmenorrhea is what are you eating? Okay, if you're eating nothing but junk food, there's a high chance you will experience dysmenorrhea. Now, I'm gonna speak to you from experience. Now, my experience is not gonna be every other woman's experience. When I have my menstrual cycle, if I eat Snickers, chocolate bars of any sort, anything sweet, I will expect to have painful menses. I will cramp like there's no tomorrow. I notice when I eat healthy, for real, my menstrual cycle is like, what makes me know that I'm even having a menstrual cycle is my stained undergarment. Sorry, guys. You understand? So I don't feel anything. You understand what I'm saying? Right. So that is why one of the main things you want to, one of the assessments that you want to collect is nutritional status. Very good, Alex. What other data would you collect? Should you collect?
We can examine the breast.
Huh?
We can examine the breast.
Why would you want to examine the breast?
Because the breast is an indicator of estrogen.
Oh, what about the, not talk about, what do you mean by estrogen? Elaborate a little more.
Or small or anything like that. So if there's any changes or anything, it's an indicator of.
Okay. Other data that you may want to collect is, okay,
Smoking.
GI, huh?
Smoking and alcohol.
What you trying to do? Blame it on the why? I thought it's good.
It's a vasoconstrictor.
It's a vasoconstrictor, which means what? In relationship to the menstrual cycle.
It'll make the pain worse. When
It will
throbs.
make the pain worse. So, ladies, or those experiencing a menstrual cycle, leave the lick alone. Damn, dog, why you cheaping it? Why you hitting your teeth? They're like, some of the ladies are like, forget that, forget the pain. Let me enjoy this dick a little bit. I'll deal with the pain afterwards.
Well,
Okay?
if you're tipsy, you're not gonna feel that much pain.
That's not the
Okay, I'm not gonna ask how you know, okay? Alex, you had your hand raised.
Yeah, with the nutrition thing as well, having dysmenorrhea, amenorrhea could be indicated with them having an eating disorder as well.
Ooh. How so?
I guess it says the relationship between eating disorders and menstrual dysfunction has been identified in research studies. It's experienced in over 50% of females with eating disorders.
If your nutrition is very inadequate, I mean you have poor nutritional intake, your menstrual cycle will be very off, if that makes sense. Sometimes even because of inadequate nutrition, let's say for those who are anorexic, etc., they may experience, not only may they experience dysmenorrhea, but they can also experience amenorrhea as well, because now your body ain't got nothing to go on. Okay? Now, also remember, with regards to dysmenorrhea, you may also want to collect information related to dizziness. Jenny said something too with regards to the breast. You want to examine the breast because the breast could be tender at that time. Many women during their menstrual cycle don't touch them. Okay, men? So let me tell you fellas, let me put you up on game for a little bit. When you try to be with your girl and you know what I'm saying, you try to do them too, and they tell you don't touch them, that's probably why, because it's tender, they don't want you touching them in their breast, okay? Alright? Leave them alone. Some of them you can't even come 10 feet near them, okay, when they're on their cycle, okay? So it's tender. They might even experience GI issues during their menstrual cycle, like diarrhea. They're very fatigued, huh?
Bloating.
Oh, don't even get me started on the bloating, okay? Forget the two-piece suit, you know, for the bikini, you know, for the beach. Yeah, it ain't happening because it ain't gonna look right, at least during that time phase, okay? So also they might experience what? Muscle aches, they may be very tired, etc., okay? And may have food cravings. Now, you notice how, men, you may not know this, but the menstrual dysmenorrhea assessment, that data collection could also be similar to what other experience? Food cravings,
pregnancy.
pregnancy. So that's what, Say it again. Presumptive signs of pregnancy. Look at her being ready for when we get to that part, okay? This is why data collection, accurate data collection is very important. One data collection is going to probe you to collect other data, all right? Let's keep it moving. Then you have dysfunction in uterine bleeding. What is that? What is that? Jorge, dysfunctional uterine bleeding or abnormal uterine bleeding, AUB.
Larger volume bleeding compared to what they normally experience.
Say it louder because Torres needs that answer for the next exam.
A larger flow of bleeding that is not regularly what they experience.
A longer flow of bleeding that is longer and is not as regular than what they normally experience. In addition to a prolonged bleeding, okay, what else are they experiencing? Is it painful or painless?
Painless.
It's painless! That question, I know. When I put it, it better not be an issue. And Ricky better not find a one word here and there to give me problems on that question. Okay? Huh?
Yeah, Ricky,
I'm saying Ricky, Ricardo, my bad, okay? All right? Now, also, when does it occur, AUB?
The beginning and end of reproductive years.
You see that? Say it again, please, louder. When does it occur?
Most often occurs at the beginning and end of reproductive years.
Make sure you know that. Timing. Pay attention to the timing. And it says beginning and end of the reproductive years. When is your reproductive years, by the way?
Puberty till
Till when?
yeah, but I don't know the age.
Menopause.
What's the age for menopause? 55?
It's different for some
It's different
women.
from different women. We gonna get to that, okay? Now it doesn't mean that there is perimenopause, which we'll talk about too, and then there are women who has gotten pregnant during their perimenopausal years, okay? So it does happen, okay? Now, how do we deal with AUB? What's the treatment, management, or how we manage it?
Underlying cause.
Yes.
Not to answer, I have a question.
Damn. All right. Before we get your question, Francis, science. How do we treat AUB?
With birth control, right?
Estrogens.
Okay. Yes. What else? What else?
exercise.
Progestin.
I didn't hear. We said exercise. Okay.
Increase endorphins and suppress prostaglandin and release.
All right. Okay. We said. So you saying exercise and what else?
Water.
Birth control.
That's what he said. Birth control. IUDs.
Iron replacement therapy.
You said wait. You said IUDs or iron replacement?
We said both.
Oh, you saying both? Okay. What else? What is the more invasive method?
Surgery.
Which surgery?
Cauterization.
Hysterectomy.
Burning it.
Damn. Okay. Yeah. Hysterectomy. What else? Embolization. What else?
Ablation.
Ablation. And what else?
Curettage.
And DNC as well, okay? Make sure you know the different treatment methods, okay? When dealing with AUB or DUB, okay? What's your question, Nurse Francis?
I kind of answered it myself, but it's the way it says it's common, somewhat debilitating in females of reproductive age. I was confused by that because it labels it as painless. If you look further on, it says it causes or it's related to polyps or hyperplasia, changes in clotting pathways such as coagulopathies or hormone disturbance such as ovulatory and endocrine disorders that lead to alterations in menstruation. The bleeding is heavy, not infrequent enough. Anemia can result. So that's why it would be debilitating, right?
Yes, in that sense. Even though that's actually a great observation. Because how you gonna say it's painless, but then you're gonna use the word debilitating, and I vex it at the question begs, what in the world does debilitating mean?
It's painless bleeding.
Yeah, I think it just means like
disturbances in normal life.
Okay, so debilitated doesn't mean you're going to be crippled or or whatnot. Okay, but that's I like that definition. All right. Now remember, in any and everything that you do, you always involve your patient. You're always educating your patient. Make sure you remember that. We learned this during the first semester. Any and everything that you do, you involve your patient. PMS, premenstrual syndrome. What the heck is that?
It's a sign basically that your period is about to come.
It's a sign that your period is about to come. Bruh. Okay?
It's the sirens.
What are the symptoms?
Yeah.
It's
The red flags.
the red flags. Get out for the men to get out. The red flag. Now, okay, what are the signs? Irritability. What else?
Depression.
Sometimes depression.
Craving, bloating.
Now, it is a wide range of symptoms. Okay? There's no one size fit all. Okay? Like, it's just very vast.
I was one of them.
Yes, Anna.
Really, the signs for PMD can also like be another. It can mimic for pregnancy.
Oh, doesn't that sound like dysmenorrhea? Just like the signs and symptoms of dysmenorrhea. A lot of them can mimic these abnormalities can mimic signs of pregnancy. Okay. Okay. Now, since we don't know what causes PMS, by the way.
Hormones?
Hormones. Cassie?
It says cigarette smoking.
I would never forget your name. Go ahead.
Cigarette smoking, anxiety, family history.
Yeah, that's
Struggle or traumatic life event.
That causes PMS?
Or like PMS or PMDD, both.
Oh, I'm seeing.
So that one pertains to.
Wait, say it again.
For PMS and
Like depression and
PMDD, the risk factors.
Those are the risk factors, but what's the cause? What's the cause? What does the book say is the cause of PMS or PMDD? PMDD.
Is it like the phase you're in?
What's the difference?
Interaction between hormonal
This is like
events
going more, but like
mostly
not necessarily like
Or is it because
physical.
the phase that you're in?
Like these are all.
Ariana, and then Grace.
It says on 98 that it is thought that the symptoms are related to the interaction between hormonal events and central neurotransmitter function, most notably serotonin.
Okay. You had a different response?
Nope.
What's your question?
The symptoms, since the exact cause of the condition are still unknown, so they just address the symptoms.
Say it again.
Therapeutic interventions for PMS and PMDD address the symptoms, since the exact causes of this condition.
The
are still
cause is unknown. The exact cause. Yeah, right there. That's what I read too. But you, Ariana, was reading to what? The symptoms.
Yeah.
Okay? Pay attention to the question. All right? What causes PMS? What causes PMDD? We still don't know. With all this advancement in technology, they still don't know what causes it. They just know it exists. That's all we know. Okay? Now, how do we deal with it?
Treat the symptoms.
Okay? Like how? Lifestyle changes. What else? Diet. Change your nutritional intake. Go on drdre.com and look at all the nutrition, the right way to eat. What's your thing? Chicken, grilled chicken, broccoli, rice cakes. You know, I'm just kidding, okay? But make sure you know you eat correctly, eat healthy. What else?
It says vitamin supplements.
Vitamin supplements and medications as necessary. Now, remember, when it comes to therapeutic treatment, with regards to whatever we're dealing with, we always start least invasive and go more invasive. So when it comes to therapeutic management, what is the first thing we might encourage the client who's suffering from PMS or PMDD to do?
Reduce
Diet
stress.
and then
Reduce stress, maybe. What? Exercise. Where we're treating them on how to eat, how to exercise, and
Relax.
stress. Stay away from the
Stay away from guys.
Bruh!
Amen.
Change your lifestyle, stop it. And then, you're wrong with that one, okay? And then if need be, in addition to if other alterations need, management is necessary, you may encourage medication,
Like
okay?
SSRIs.
Huh?
SSRIs.
Oh,
Selective serotonin reuptake inhibitors.
okay, the meds. What are the meds that the books may encourage as part of therapeutic, not encourage, but may prescribe? What may be expected, what is an expected prescription for PMS, according to the book?
SSRIs, SNRIs.
Our first line treatment.
And DNRH, yeah, agonists.
Okay.
And
All right, so we got SSRIs, NSAIDs, oral contraceptives may be used, and you said something else with some with a lot of letters.
GnRH.
Huh? No, SSRIs, we said that.
SNRI.
Gonadotropin releasing hormone.
Gonadotropin, something hormone. What the heck is that? Gonadotropin hormones? Is that what it says?
Yeah.
Let's read the whole thing for book for test purposes.
Releasing hormone.
Gonadotropins releasing GR
Agonist.
agonist. It says GR hormones or something like that.
GnRH.
GnRH. Okay, I remember the alphabet. Okay, my bad. Okay, and
Selective norepinephrine reuptake inhibitors as well.
wait, hold on. GnRH hormones is one medication you could expect to be prescribed, and you said what now?
I said SSRIs before, but there's also SNRIs, the selective norepinephrine reuptake inhibitors.
So there's SSRIs, SNRIs, selected. Don't that sound like, isn't that psych meds?
Yeah.
They're
What they trying to say though?
They're
It's pretty
antidepressants,
obvious.
but they don't need to be taken every day.
Crazy.
Damn! We are not, okay? It may be the food, okay? Who knows? Okay? Alright, yes, Alex.
Did we talk about
Strange that
psychological things?
antidepressants, they don't need to take them every
Not
day,
yet.
but they're effective when you think cyclically or only in the luteal phase or the duration of the symptoms. Can't that affect your brain if you're taking the SSRIs not constantly?
Hence why you would encourage what first? This is why it's gonna be your last, yeah.
But don't SSRIs also take time to work?
Yeah.
That part.
That's why.
That's another part. Yes, they do. Look at you. Dr. Grimm will be very proud of y'all.
It's like up to a month.
What?
But
What?
it says it's a first line treatment.
Yeah.
pharmacological.
Treatment, the clinic.
Pharmacologically speaking.
Yeah.
Okay, let's make sure we clear that up. When it deals with management PMS and PMDD, what are you doing first?
Non-invasive.
Non-invasive, non-pharmacologic methods. You're educating, change how you eat. Change your lifestyle. Get up and walk more. Go exercise. Go to somebody's gym. Go do HIIT. I don't know. Okay? What else? What else? Lifestyle. Then if those doesn't work, then we're gonna go into prescriptive methods. Okay? As those listed. Let's move fast because we got other stuff to do. Endometriosis. What the heck is that? We talked about it a little bit. What is endometriosis?
When endometrial tissue grow outside of the uterus, around the pelvis in places that it shouldn't.
And what are the signs and symptoms?
Pain.
What do you notice with endometriosis? What are some data you may collect?
Infertility.
Infertility is definitely one of them. We're gonna talk about that. What else? What else? Say it louder. Pain. Yes. What else?
Isn't abnormal menstrual cycles?
You will have definitely your menstrual cycle will be abnormal. Okay, it will be painful. What else? What are some other nursing assessments or data that you will collect with regards to endometriosis?
Hematuria.
Well, yeah. Yeah. you're gonna-
Too.
But when you say hematuria, I want you to be specific. What do you mean? Elaborate a little more.
There's blood in the urine.
Okay, hematuria. How will you know it's hematuria and it's not just a regular menstrual cycle versus that and the other? Now it begs me to ask that, because I don't know. You brought it up.
I guess that would be hard to tell, wouldn't it?
It's out of the normal.
This what the book say.
How, okay, yeah, that's what the book said, but how would you assess that?
I get what you're saying, yeah.
How would you assess the hematuria versus your menstrual cycle, that, bleeding cycle? Okay, Anna?
Painful sexual intercourse.
Okay, first of
Your
all,
your analysis.
wait, that's how you're gonna assess the difference between hematuria and...
Oh, no, I'm sorry. I thought you were still giving her that question. I'm just
So your analysis.
Are you answering the question? Oh, Nurse Treasure?
Like the characteristics, so the amount, the presence of clots, and possibly the color.
Okay, she says she will be able to differentiate. Nurse Treasure says that she would be able to differentiate the differences between hematuria and menses of a patient who is experiencing endometriosis by noting the characteristics of the output. She says she's gonna note like maybe clots, presence of a clots. She's gonna note what else you said?
The amount.
The amount. Okay, what else? And the color. She gonna note the amount and the color. Jenny, then Grace, and then Shannon.
The book says, in short, the person with endometriosis experiences several mini periods throughout
That's
their
what I was gonna
abdomen.
say.
I really?
Yeah.
Oh, that's exactly what I was gonna say.
She got you, and she beat you to it. Your bad.
It's Sherry.
Okay, y'all sharing answers.
Yeah.
Go ahead. What does the book say?
Yes, it's mini periods throughout their abdomen, so it's kind of like a pelvic something periods.
So, based off of that, it'd still be difficult, right? Because if they're
Right.
having a mini period, they're still gonna be bleeding.
Mm-hmm.
And if you're bleeding, it's still gonna be hard to tell the difference between what's blood in the urine and what's from the mini periods. So that's why it's like, I don't know, how would you be able to tell the difference? Because even it'd be hard to do like a clean catch, right?
It would. It sure would be.
I don't think it says it in the book, but like, not to sound weird, if you're wearing a
Y'all know y'all could look this answer up, right? Like there's Lippy Cut Advisor and...
if you're using a
I
tampon,
was trying not to say that.
if you're using a tampon
Mm-hmm.
and you pee,
Mm-hmm.
that can, cause like then the blood can't necessarily come out at the same time. That's just my not booked guess.
And that's another thing.
That would help.
They use the tampon, but they will have a lot of pain with the tampon.
They're using the tampon.
And they will have a lot.
They will have a lot of pain with the tampons in.
I'm just
Okay,
talking about
but I'm trying to
differentiating
differentiate between hematuria and your menstrual cycle.
That's why I'm
How do
saying
you go?
tampon.
Because we need this data. Because according to what you told me, hematuria is an assessment that we need to collect with relation as it relates to endometriosis. How do we collect that information? I don't know. How are you going to correctly and adequately collect that particular data?
When I worked with a women's nurse practitioner, we would have patients that had extended periods of menstrual cycles. We would have to have that patient come back routinely to keep getting assessed over and over again, because symptoms plus the bleeding, you couldn't tell the difference. You couldn't tell if they were on their period or if they were just, endometriosis or figuring out what the diagnosis is. But they would have to keep coming back routinely, sometimes for.
And you would collect the sample that way? You would just collect the urine?
I would.
No, I mean not you, but you would have the office, the physician.
That on top of a pelvic exam and an ultrasound.
Oh, we getting somewhere. Now we are talking. Hold on, Kirsten and then Daniel Francis.
Well, I was gonna say the pelvic exams, like frequently, like to check like for lesions or like assess the uterine wall. Like, I mean, I feel like that's the only way to be able to tell.
Okay, Francis?
The book doesn't say it specifically, or at least I was thinking it would, but would hematuria persist outside of these periods? So if you have blood in your urine when you're not necessarily bleeding from your normal menses,
That's a good question. That is a good question.
That could be a symptom. That could indicate it.
That is a good question. Now, Francis brought up a very interesting question. With a woman experiencing endometriosis, would they experience hematuria outside of their menstrual cycle?
Yeah.
Yes. Okay, and that is how you would do it. Now, could they tell? No, you won't know until you collect that sample.
Right.
Okay, now when you collect the sample, it kind of falls back on what Treasure said. Now you're gonna see the clots and with the normal menstrual cycle. I know, fellas, you will not know what to expect with the normal menstrual cycle, but you will see clots, and it's very, very red. Okay, and gross. Okay, but with hematuria, you will see urine, but in the urine, you'll notice the urine being either slightly red or red.
Right, and that goes off of what he was saying too, is like if you're doing these constant urine exams, you're gonna get the samples during the period, after the period, before it starts up again, blah, 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 so on. And then you would see,
That's the reason
you would
why.
see the reoccurring thing, like, oh, well, you know.
There you
look at
go.
her urine.
You
They also
see?
do the
Now y'all see how y'all was able to come with that from outside of the book? Thinking. Oh, look at y'all critical thinking. Okay? Now, besides Francis, somebody else had their hand raised? Shannon? No? Okay. Now, of course, when it comes to endometriosis, now there's therapeutic management that includes what? How do we deal with it? How are we supposed to manage endometriosis?
Surgery.
Surgery and surgery. What did you say, Francis?
I say
Suppressive agents.
Oh, who was it? Oh, Alex.
Gold standard,
Wait, hold on. One at a time. Alex.
gold standard is laparoscopic excision surgery. Well, pain relieving drugs, hormones, suppressants, and addressing.
Okay, so Alex says, according to the book, is laparoscopic surgery. Okay, and you're gonna give medications for pain, and you said something else. And hormonal replacement. All right. You was gonna say something, Science?
No, suppressive.
Oh, just what he was saying. Okay, Shannon.
The book also says to refer them to support groups because they're going through a lot of chronic pain, so you have to treat the mental health aspect of it as well.
That part. And a lot of people tend to negate or not take that part seriously. That is a part of providing holistic care. Okay? Because let me tell you, women, all we want to do is live this life, go on and, live life.
Well, it's standard to just kind of like keep moving even if you're feeling pain. So a lot of women don't even realize they have endometriosis.
Right.
I
And
think
not
it
only
doesn't run in the
that, what are the risk factors associated with endometriosis if it's not treated quickly? Infertility. Now in certain cultures, majority of us are in those cultures right now, how infertility is a big deal. Like, bro, if you like 23 and you ain't ready and you ain't married yet, okay, or 25, you're Haitians like to say "Doopsies by movie no more." Like, the game double six. Like, it's gonna the domino game. Never mind. That means you getting old, okay? And if you not married and having kids by a certain age, like the society is gonna be you against society for that one little thing. And I say little, it's not little, but that one main thing, which is not having children. And imagine having endometriosis. Imagine a woman suffering endometriosis who's of a culture that makes that prides itself on having children. And that culture doesn't care about your endometriosis issues. They care about you reproducing. That mental care that you talked about is very important, especially for those women. Not to say that women who doesn't come from those cultures that doesn't need it, but it's very much more needed even for them because they're having a lot of issues to deal with. The health issues, the endometriosis, the infertility, and the pain that is associated with it, and the treatment.
So 2 things. He said for the surgery, it says that is the only way to diagnose it.
Mm-hmm.
And they said they use it to also remove the lesions, but that's why they slip through a lot of the cracks whether it's a late diagnosis. But it also says in the book it can be asymptomatic.
Endometriosis can be asymptomatic. You're right.
Why it can be severe?
It can, and now listen, and now, when you bring that part up, there are some people who don't even go to the doctor's office, okay? And if I don't feel nothing, why do I need to go? Why fix what's not broken, in other words, all right? But when it's caught later in life,
it's harder to fix.
It's harder to fix. This is why doing certain community education of some way, shape, or form is very important because yes, it can go asymptomatic, and if we don't catch it early enough, it leads to further issues. Okay. All right. Anything else? All right, we good. So again, so we deal with it. We already talked about the treatment. Nurses, we have to provide a lot of education surrounding endometriosis, making sure we promote a healthy lifestyle, and of course, like you said, promoting a support group. All right, let's keep it moving. Menstrual disorders. Infertility, we already talked about it a little bit. Well, let's talk about menstrual disorders. Okay, first of all, we already talked about menstrual disorders in a nutshell, okay? Let's get down to infertility. With regards to infertility, you must know there is how many types of infertility?
Two main ones.
Two main ones, which are?
Primary, secondary.
What's the difference between primary and secondary?
Secondary is caused by underlying health conditions. Primary is broken down into two categories. One of them is if you don't have your period before 14 and also don't have secondary characteristics. The other one is before 16, but you do have secondary characteristics.
Good. Torres, infertility is limited to which gender?
Both. Sorry.
Oh, okay. I thought I was going to get you on that one. Okay. Both genders can experience infertility. Okay? But it's typically harder on who? Okay? Typically. Okay? Now, we could get into all the aspects as it relates, blah, blah, blah. But fertility, now, some men, they may choose to be infertile. How? What? By getting what? A vasectomy. What is a vasectomy again?
Elective procedure.
What's that snip, snap, snoop? What is it? How they just say it again? Snip, snap, snip, snap. Okay, cut it in. It's okay, and that's how a lot of them get their
Get their what?
No, they're women catching on for infidelity. But you know, we'll leave that alone. All right. Now, what we gonna say? What I was gonna say? Therapeutic for now. How do we deal with infertility in generally? How is it dealt with, or treated, or managed?
Assess.
First you assess, and then if they have been trying for a year and there's no pregnancy, then don't they refer them to an infertility doctor?
Okay, you're talking about the process in general. Okay, depending, yeah, that could happen.
It depends on like their culture and their religion, because some of them don't view it as like if you can't get pregnant, they believe it's like a spiritual issue.
Mm-hmm.
You have to go to church and do this, and they don't believe in like IVF or anything. So you have to figure out if they want.
Okay, I was going to get to that, but before we get to that part, medically speaking, how is infertility managed or treated?
Drugs and surgery.
Drugs and surgery. Okay, drugs and surgery. What drugs? Does a book mention drugs? I can't remember. I can't remember.
Yes.
Yes, it does.
Okay, what are the drugs?
There is
Clomiphene, hormone injections. What else?
artificial insemination.
Artificial insemination. And anything else?
Gonadotropin therapy.
Gonadotropin therapy. Okay, basically they're trying to give you these sex hormones and stuff like that. All right, good. Now, Cassie mentioned religion and culture when it comes to infertility, which could be a big issue. Cassie, how in the world, can you give me an example of a culture where it is contraindicated to using some form of infertility measure?
The book says African Americans and Hispanic people are often spiritual and may consider infertility as a test of faith, leading them to seek spiritual counseling. So they don't, and then it says African Americans believe assisted reproductive techniques are unnatural and that they remove the spiritual or divine nature of creation from themselves.
Okay, I'm gonna need for you to be louder because you know what I'm saying.
Read the book on page 108. Cultural considerations in the middle. It says African Americans believe that assisted reproductive techniques are unnatural.
So that means what? speak to me like I'm a foreign 2-year-old. I just got off the boat
But
the
they
other
don't want
day.
you going to the doctor and having to help you that if you can't be pregnant, there's something wrong with you and your spiritual being and you have to do that.
So African Americans and who else? And Hispanics mentioned in the book are 2 cultures mentioned in the book that you should not go to nobody and try to get pregnant. You need to get pregnant the natural way. Okay? It is unnatural to go seek the services of a healthcare provider to go get pregnant. Okay? And what about the other culture?
It says for Hispanics, it's a test of faith.
Yeah. Okay? It doesn't matter if you've been waiting 20, 30 years. Just wait.
Just go
Just wait. Okay? And that is a very sensitive issue right there. All right? Because some people, if you go, for them, if you go seeking help from a medical provider, that means you don't have faith in God and stuff like that. So then now it's a test, okay? And which you might fail, according to them.
Is there any like herbal tea things that they kind of believe that helps?
Yeah. A lot. You know some?
No, but I do know there's like certain teas that increases your
Chances of becoming pregnant? There is. Now, on the flip side, there are teas that they will use to keep you from being pregnant. Haitians know that very well, okay? We know it. You understand? You know?
Like a gallon that they fill with like, what is that? Just something.
For infertility? To get pregnant? Or to I don't know about the gallon one, but there are some herbs that, you know, if you were doing the 2 and you know you wasn't of that age yet, you weren't married, you know what I'm saying, certain cultures, you're gonna sit that real quick, you know what I'm saying, you know?
Can you buy that at the garden center, Home Depot?
Not at the garden center at Home Depot, because I don't think Home Depot got that herb, but we gonna leave that alone. Okay? On the flip side, if you don't want to get pregnant, there are certain herbs that they do have, that certain cultures, they do promote, you know, so you don't get pregnant. But on the flip side, there are herbs that that they will encourage you to take and consume so that you can get pregnant. You just gotta know which one it is. Now that you mentioned the herbs, Jeff, this is where, you know, as a nurse and you know of these things, you have to really ask these questions. Because if you're first of all, if you're taking certain herbs, this is where you as a nurse have to be well versed, because they're taking these medications, number one, there is no dosage. They're just going according to whatever the spirit world tells them to do, okay? And number one. Secondly, it can pose a threat, okay? Because while you're trying to keep from being pregnant, but it can also cause other health issues if you are not careful. And many of these people do not know that. They just know it's going to help with this situation, not knowing if they're not careful, it can cause other health issues. This is where education is very important, okay? Now, of course, you're going to do some lab diagnostics and stuff like that. The labs, you mentioned medications for pregnancy is clomiphene. You're going to do laparoscopic, etc. That's what we said. Now, contraceptives. With regards to contraceptives, what are contraceptives, first of all? I don't know, I'm 2. Huh? What about pregnancy?
preventive.
So these pills that you pop, it's only pills, right?
No.
What you mean no? I just know contraceptive pills.
Injections.
Yeah.
Oh, talk to me. How y'all know? I just asked how y'all know. I ain't saying nothing. I just asked how you know. You know, you can say I read the book. That's what you can say. There's abstinence. Abstinence is a form of contraception, practiced by everybody.
What is that?
Abstinence. Not trying to say, the pull-out method. The pull-out. Let's talk about the pull-out. What is the correct word? The correct medical term for pull-out method?
Coitus interruptus.
Coitus interruptus. When I saw that, I was like, bruh. Okay. I mean.
How do you spell that first word?
Coitus, C-O-I, coitus. No, not coitus. Alright, science, since you brought up the pull-out method, alright, or AKA coitus interruptus, what is that? How is it done? Talk to me about it. Let's go. Hey, he's giving me some education.
Before making the donut a cream pie, that's a legit donut, Boston cream pie.
It's in the book.
It's
in the book?
No.
Oh, I was gonna say, I didn't read that.
This
Boston
boy
cream
said
pie.
before making the donut and cream.
Hold on. He
I
said,
guess we know who to call when we need the birds and the bees.
I know, right?
That's what it says in the book.
The Boston cream pie?
Yeah.
Okay, bro. Okay. It's page 41. Vanessa, could you come validate? Is that what it says? Boston cream.
crying.
Page 41. He says the Boston cream pie.
41.
Wow.
Wow. The right chapter.
Page 113.
113.
Where the hell
Boston cream pie. Did I skip that section?
Yeah, I think you did. Oh, sorry, yeah, 121.
121 now.
You said Boston cream pie.
Basically, it says that this method requires the female to really trust their partner.
It says, it is better known colloquially as pulling out.
But no, he said, I know that. He said the Boston cream pie.
It's in really
Where's
fine
that?
print.
That's what I'm looking for.
It's in really fine print.
It's in really fine. Oh, now it's in really fine print. Go ahead. Now, seriously, explain the pull-out.
In medical terms.
Uh-huh.
Basically, you're not ejaculating inside.
You're not ejaculating inside of the woman when you feel like the need to ejaculate. Okay? Now, is that that is the most true or false? That is the most safest method to prevent pregnancy. Damn.
That's called the safe.
Even the men are saying false. Like y'all, but we in the book, didn't the book say we gotta trust y'all though? Aren't we supposed to trust y'all? No. Tara's like, bro, if you don't want to get pregnant, bro, just.
We ain't gonna mess that one up, I promise you that.
What?
We're not gonna mess that one up. You can trust us on that.
Which one?
The pull-out method.
You not gonna what?
He said we're not gonna mess that one up.
Because there's a leg lock.
That's how my brother was born.
What?
Okay, now he getting okay.
No, because you just said it depends.
No, but you can get pregnant from pre-cum too, though.
That is very true. That is actually very true.
Wait, but y'all notice that Dre is very silent right now.
I have a daughter, dude.
That's why I said the leg lock. He probably
Oh, he's probably a victim. Hence why he got the daughter.
Well, she's also Latina, so.
Oh, there you go. Latinos don't play. Okay.
No, they're like fertile fucking, you can breathe on them and that's it.
Wow, really? Okay, if I have time, we're gonna argue that statement. Okay, remember what you said?
You can breathe on them?
Uh-huh.
Well, just share bathwater, that's what I meant.
Okay. All right. We're gonna talk about that one. Yes. Oh, can you? Hold on. Nurse Ariana is putting us on game. Ariana, please.
The problem with the coitus interruptus is that the first few drops of true ejaculate contain the greatest concentration of sperm.
Which means what in plain English, ma'am?
Pre-cum makes you pregnant.
There you go. Okay? So this is the education that you need to provide because these men think that they, you know what I'm saying, you can trust me, we got this.
I'll take it back.
Yeah. But when you're in the moment.
That's why two forms are always important. Two forms of contraception.
Yeah, so you gotta know
when to pull out.
is happening.
You gotta know when to hold up.
Okay. That's one form of contraception. What's another form of contraception besides a coitus interruptus? Condoms. That's 100% safe. 100% guaranteed.
No. 99.99%.
Okay, why?
Because they can
So that it's
they can break
Huh?
they can break the intervals, they can have impurities, they're not always guaranteed to be.
And they can expect, okay, if you're not careful, if you had them sitting there for decades, you know what I'm saying? That first of all,
And to
the-
be honest, a lot of men don't put them on correctly.
Right.
okay, hold on. That is actually a valid thing. A lot of times it's not put on correctly.
Even the book says that when used correctly, you're like,
So what is the correct way to actually put on a condom?
Well, it shows you on one point.
Which should the condom be placed?
Oh.
Huh? No, hold on. Wait. We have to provide adequate, correct education. When as a form of contraception, when is the correct timing to apply a condom?
Before the penis enters the vagina, that's what it says in the book.
When you're thinking about it.
Wait, when you're thinking. Hold on, that part.
Put
Kirsten.
on- It says when used correctly, the external condom is put on over an erect penis before it enters the vagina and is worn throughout sexual intercourse.
You need to pinch.
Does that make sense? I mean, it makes sense. That's not the question, but everyone understands
you
that.
think it
I
makes
figured that was
sense.
common knowledge.
No,
No.
it is not common knowledge. Not everyone knows that. You cannot assume.
Common sense is not
So, in other words, some people actually believe that they will put on the condom when they're about to, during foreplay, I don't know, whatever, when you just, hey!
You gotta block the STD.
I'm just picturing that. Wait.
Okay? The penis has to be erect. Okay? Yes, you are with the other person, the penis has to be erect. And when the penis is erect, before it enters the vagina, okay, then you put on the condom on an erect penis.
You need to pinch the tip so you leave room.
Say that, is that what the book says? Or?
Yes.
No, I just want to make sure.
Leave space at the tip helps ensure the condom will not break during ejaculation.
That is correct.
Okay? All right. That's another form of contraception. Okay.
Best
Great.
lecture ever.
That didn't sound right at that point in time. Okay, I'm just saying, All right. So we said condom. What's another form of contraception?
The ring.
The basal body temperature. Wow. Talk to me about that, Nurse Francis.
Doesn't that have to do with
Okay, your lifeline treasure is helping you
It
out.
has to do with fertility when you're most fertile.
Okay, no, elaborate. You need to know this. What does the book say is basal body temperature? What about it?
The first to the lowest temperature reached on awakening.
Okay, you read that part. Very nice. What does it mean in terms of a form of contraceptive? Does basal body temperature mean? What is it? Talk to me about the steps.
Your body temp raises when you're ovulating.
Okay.
So when it's lower, you're not ovulating.
So what does that mean for the woman who's trying not to get pregnant?
Lower chances of pregnancy.
She has to do what?
Check her temperature every day.
Every day, but when every day?
On rising.
Upon rising up. Okay?
Okay, so I have a
But
question.
where is that?
No, when you rise up, you check your temperature every single day. You look at trends. Okay? She may want to do this for about 1 to 2 months to know for trend before thinking about doing the do. Okay? You note the trends, and the time where your body temperature is what? The lowest or the highest is when you're pregnant. When your body temperature is the highest is when you're most likely to be pregnant. Is that not what the book say?
Yes.
Not in those exact words, but it says the opposite, if I'm not mistaken, is when your body temperature is the lowest, that's when your chances of being pregnant is low. Okay? Yes.
And this is important to keep in mind because, and this was on the pretest, I don't think fertility awareness-based methods, which is what basal body temperature is under, is considered a contraceptive.
Why not?
Because it's not a good form to avoid pregnancy. It's just used to look
Be
for like
aware?
ovulation times and stuff like that. It's a guess. I don't think it counts as a contraceptive.
I would put that more under like fertility kind of
Well, it's
Like
to be aware.
like trying to plan for
Determine your,
Mm-hmm.
pregnancy rather than like trying to plan against it.
Don't they have it in under the headline contraception or something?
They do.
They do? Okay.
They do, but I don't think it's because it was on.
So
the
you're
pretest
saying
as
it's not a form of contraception, it's just being aware of what your body is like physiologically.
I mean, it says, are based on identifying fertile days in the female cycle and avoiding sexual intercourse during that time. But is it counted as a contraceptive?
I mean, if you want to, I
Because
mean, that's,
all it is abstinence.
yeah.
No, so it says,
So what is based, it's just being, I see what you're saying, that's
It's
just.
it's selective
that just seems like-
abstinence.
yeah,
Is all
yeah.
it is.
Here it is. Here's the thing. It's just being aware of your body. So, in other words, if you want to not be pregnant, increase your chances of not being pregnant. You know what time of the month you should have unprotected sex.
So should we put them under contraceptives? Is really what I'm asking.
it says it's better for fertility awareness to get pregnant than it is as a contraceptive. It's a better method.
I'm not gonna test you. I see what you're trying to. I see the question. I'm not testing you according as a form of contraception, like, you know what I mean. But I see what you mean.
Yeah, because it was on the pretest and I was wondering.
Is asked that on the pretest? Like, is this which is a form of contraception? Now, is it the best form of contraception? Heck no. Because now physiologically, a lot of things could cause our body temperature to change.
It says that here too.
Okay? A lot of things could cause our body temperature to change. Stress, if we're going through a traumatic event during that
Says
time frame.
illness, drugs,
Illness,
alcohol.
there you go. So that's why it's not the best form. But at least you are aware of
119.
what's going on
At the end of the basal
physiologically.
body
That's actually a
paragraph.
good observation.
I just want to clarify. So the best way of what was it?
Contraception?
Contraception. Was it condom?
The best way?
I'm asking.
Abstinence. The best form of contraception is don't do it at all. Okay? Say no, just like they say no to drugs, say no to sex. Okay? Now the other method is a form of contraception. Of course, you said pills. Now, huh?
Lactational amenorrhea.
Lactational amenorrhea. What the heck is that?
but,
That's not.
but that's
You can still get pregnant on it though.
Okay. That's not reliable.
What does the book say?
The book says that continuous breastfeeding can usually postpone ovulation and thus prevent pregnancy. But it's fairly effective for up to 6 months after giving birth if the person has not had the menses since giving birth. It's been less than 6 months since delivery, and the person is fully or nearly fully breastfeeding at least every 4 to 6 hours.
Okay. Treasure, you was gonna say something on the contrary.
I was gonna
I'm
say, I
thinking.
mean, it is in the book, but it doesn't always happen that way.
Okay.
If.
But some women still don't have, they can do that, everything on that list, and they can still get.
And they still get pregnant. They're speaking, yes, Ricardo.
I mean, along those lines, it comes to like, I just want to clarify, kind of a 99%
Yeah, they definitely lie.
I just want to clarify that that's not correct.
That's not correct?
No.
How
Oh,
effective?
so I can sue Trojan, that's what you're
The chart
saying?
does say a 13% failure rate.
Oh,
For male
we got a
content.
class action.
So I want to make sure it's not 99%.
You know why they say that? Because that's been what's been commercialized.
Yeah, no.
I'm glad you brought that up. What does the book say?
Well, the failure rate is 13%.
So if the no, hold on. Now I'm gonna call Ricardo here. If the failure rate is 13%, 100 minus 13 is what?
99. Yeah.
That's 87.
There's still a chance of getting pregnant with the use of a condom, and there's still a chance of contracting an STI or
Along
STD.
with the other methods, it gives you the failure rate. So.
Okay? With the now, oh my God, it's almost 12 o'clock. I gotta let y'all go.
Oh, that's
Damn.
Question.
What's the question?
Plan Bs.
Oh, talk about the Plan B method.
Those aren't contraceptives.
Well,
Those are abortion.
Huh? It's under abortion.
abortion.
It's under abortion.
That's under abortion?
Plan B?
It's not contraceptive.
It's not a contraceptive.
It's an emergency contraceptive.
There you go.
Exactly.
Yeah.
It's under contraceptive? I thought it was under. Okay, okay, fine. What is the Plan B method? I have no idea what that is. I've never heard of that in my
So
life.
basically, when you did a group C and you don't wanna get pregnant.
And you don't have the herbs.
But there are.
You don't have the herbs.
First-hand experience.
Okay.
You're supposed to take it before
Ovulation.
ovulation. And if you don't,
You gotta take
it doesn't
Because
work.
technically the Plan B is to prevent.
There's also the emergency
Yes.
part
Because
about.
obviously.
I waste you so much money.
That's what I'm saying, like, what's the emergency?
According to the book, what is Plan B? According to the book, what is the Plan B method?
Reduces the risk of pregnancy after unprotected.
Melanie, please read that one loud. What is the Plan B method?
It reduces the risk of pregnancy after unprotected intercourse or contraceptive failure, such as a condom breakage, but before pregnancy is established,
Right.
and used within 72 to 120 hours.
Right.
Oh, they go up to 120 hours?
I didn't know it was
I didn't know.
that.
When
That
I,
doesn't go. The box is.
Yes, that's what it says.
no, for the purposes of this exam, any exam during this semester, I think in NCLEX 2, Plan B is an emergency contraceptive, okay? But it has to be within that time frame after sex, okay? And let's be specific, after unprotected sex. Although we have learned that the condom is 13% has a failure rate, maybe. Let me stop. But technically speaking, after having unprotected sex. Now, Treasure, you are saying you disagree with that statement because
if you're already ovulating, it's not going to work.
okay, Wednesday, I need you to come up with valid evidence. Yeah, no, because you teaching me, okay? I need you to, besides, because you gotta teach me, put me on game. Maybe I'm trying not to get pregnant in my old age. You know what I'm saying? I'm trying not to be the next Sarah. So you're gonna have to just teach me about the Plan B method and how I have to make sure I do it at a certain time. Because I might need to know, according to what you're telling me, I gotta need to know when to have sex unprotectedly and use the Plan B method. Okay? That's your homework, you and Anna. That's your homework for me Monday or Wednesday. We will continue this. Real quick. I know I'm supposed to let y'all go. You can stop the live. We're gonna continue this chapter next week. I mean Wednesday. Okay?
You're how? How?
I'm out. Good.
No, how?
Oh. I don't know.